Hello, my name is Jonathan Lawrence. I've been an osteopath since 1985 and I'd like to introduce you to my new course in craniosacral technique, which is gentle, safe, effective and will bring you in a different set of patients. The first thing one has to do is to get a sense of what's happening in the whole body. So you go through what they call the listening posts, the first of which is around the ankles. What you're feeling for here is the involuntary motion as an external and internal movement. The next point is just above the knees, the bottom of the thighs. Again, you feel the external and internal rotation. Compare the two sides, compare the rate of the movement, and so on. Then we move on to the pelvis, hands on the front of the ilia, and again you feel for the external and internal rotation. And then we move on to the diaphragm, and finally onto the head. Taking a contact initially on the occipital bone and the frontal bone, and I'm feeling for even motion. If the patient has a sinus problem, a dental problem or a neck problem, immediately you can pick it up. And then I want to go on to the cranial base with my little fingers on the occipital bone and my thumbs on the sphenoid. The course is aimed at people who already have a knowledge of anatomy and physiology. They could be dentists, doctors, osteopaths, chiropractors, massage therapists, aromatherapists, as long as you studied up to level 3 anatomy and physiology. We keep the costs of the course down because a lot of other courses are very expensive, and we want this technique to reach as many people as possible because it's so safe and effective. So having felt through the listening posts, you then have to decide what's causing the abnormality in the pattern that you feel. So maybe from the patient's case history, you've discovered a history of migraines. Very often with migraine problems, you get a dysfunction above and behind the nose and a bone called the ethmoid. So that's where to go to adjust. That was a very brief introduction to craniosacral therapy. I hope you found it interesting. If you'd like to find out more about the courses, please get in touch.